to be here. My name is Carrie Wimberly, and I am the Executive Director at the Addiction Prevention Coalition. This is our first training as part of a series that we've been working on for several months, and we're very, very excited about this. We have a partnership of many organizations that are coming together to do these trainings that is called Why Won't They Stop? It is focused toward parents, family members, concerned significant others who have loved ones who are struggling with substance use. And as loved ones, we need information to understand addiction. And we decided, okay, this is where we need to start. The very first one needs to be really a conversation about understanding addiction in a way that we probably don't unless we've been studying or going to support groups or family groups. And so we wanted to start with that. So tonight, this is the very first one, and I'll give you some more information at the end about the next ones that are coming up after this. So you can look at those, and if you want to join, we'd be happy for you to. But tonight, Bronwyn McInturf is here, and she's going to tell you a little bit more about herself, but she's been working in the Birmingham mental health community for over 20 years. She graduated with her bachelor's degree in psychology from Birmingham Southern and a master's in social work from the University of Alabama. She works at UAB addiction. No, I'm going to say that wrong.
That's fine.
Addiction recovery. She's going to tell you all about it. But she is a partner and a friend and one of my very favorite teachers. So you guys are in for a treat. She's going to teach us some things, and then she's got 3 people who have graciously agreed to share from their own experience and their own journey, which is going to make this event even more spectacular. So I'm not going to spend any more time talking, and I'm going to let her introduce herself, and then I'm going to run the slides. So thank you so much, Bronwyn. We're really looking forward to this.
Thanks, Carrie, and thanks for your efforts and the Addiction Prevention Coalition's efforts and coming up with these ideas and making them happen, which is important. So thank you. Well, good evening, everyone. The first slide doesn't matter if it's up or not. It's just the title, and it says Addiction is a Disease and Why It Matters. Stole that title and amended it a little bit from a 1996 article that was in Science by Alan Leshner, at the time the head of the National Institute of Drug Abuse. And at that time, he was writing this article about the science behind addiction as a disease and how can we use that to help us help other folks that have the disease of addiction and families. And many of the things that he said in that article really still resonate today. So he actually said, his title was Addiction is a Brain Disease and Why It Matters. So his article touched me a lot and helped me as a young professional, and I like to hearken back to that. All right, so if you don't mind, and I can send the link to that article to all if you want. So who am I? Why am I here? Why do we care? As Carrie said, I'm a mental health professional, and I've been in this field over 21 years. I started out in this area because I got the advice early on that if I wanted to do anything in mental health, I really needed to know about the field of addiction because it is prevalent, it is prominent, and it's going to touch the lives of a lot of people that I'm going to work with. And I do just want to say hi to all the folks coming in from all these wonderful places. I'm so glad y'all are interacting in the chat. So I decided to enter the field of addiction, just thought I'm going to get my feet wet, learn a little bit about this. and get out. And here I am over 21 years later, still in it because I love it, because I've been touched by it personally, professionally. I really can't think of something as a practitioner that has allowed me to get as close to patients, see as much change, and be challenged and rewarded as much as addiction has. So working in this field has. I am not a person in long-term recovery, but I am a strong ally. And whenever I do a talk, I like to either introduce through clips or somebody that I bring with me, the voice of recovery. That's not my voice. I've learned a lot about it. It's just not my personal experience. So I'm going to wait to introduce them, but I'm very honored to have the voices of recovery in the room tonight as well. And they're going to be the real star. You'll do the boring stuff with me, then we'll get to the meat. So yeah, I have a master's degree. I direct services at UAB addiction recovery programs in the Center for Psychiatric Medicine. So if you don't mind advancing that, Carrie. So yeah, let me just tell you a little bit about what we do every day. The University of Alabama at Birmingham is the largest employer in the state of Alabama, and we have addiction services that I think rival, the most progressive states in the country. We have detox, we have an intensive outpatient treatment. We offer, for those who complete our treatment program, 2 years of group therapy that continues after they complete treatment. We offer family services that are just as prominent as our services for our patients that are in treatment. We do professional evaluations for healthcare professionals, consults, and our consult service has grown. I forget the exact percentage, but I think over the past 2 years, 600%. So this consult service was started 5 years ago, and we go house-wide throughout UAB to the bedside to any patient who is identified as wanting help with an addiction issue, or that the primary team wants them to be evaluated for that. We have special relationships with our liver team, our heart transplant team, lung transplant, to be able to evaluate patients and get them transplanted before what used to be a 6-month waiting period if they had a history of addiction. And most of them died during that time. Now we're able to get them in treatment and save lives if they show that willingness and start to participate in services. And we started peer support. We've had peer support for a while, but we started that with full-time positions in August of 2019. And we have 4 full-time positions, and they are integrated into our treatment and into our consult team and into our detox team. And then specialty services, we offer a variety of evidence-based therapy services to our clients that are in treatment with us. You can see all those little letters down there. I'm not going to say those out loud because they're boring, but just to say that our team is talented and we take great care of our patients. So thanks for letting me share about what we do and who we are. And if you don't mind advancing that, Carrie. So I'm used to Zoom meetings. This is a webinar. So I don't know exactly if you can, raise hands or ask questions, but you can certainly put that in the chat. So as you come in tonight, I just invite you to feel welcome. I'm really glad you're here, and I'm really glad to be here. And I want you to know that keeping an open mind, it's okay to not agree with everything said. Just ask you to come in and review what you hear. I love and the team does as well, when you ask questions and you're involved. And I've already seen so many people tapping in the chat. That's awesome. Keep doing that. I encourage you to, and I'll just say, hey, Tiffany, I'll try to comment every now and then. So thank you for commenting. Stay to the end if you can. The end is going to be the best. And as Carrie said, this is just the beginning. There's going to be a whole series of these meetings. I hope you'll keep coming. They're going to only get better from tonight, I promise.
Hey,
All right.
Bronwyn,
Yes.
Jamie is asking if you guys are in or associated with the UAB task program.
Task is a part of UAB. You're right. Task and its treatment program Beacon, and it used to be called Task. It's now called, I think they're the criminal justice program, but they are our sister program. Hey, Christy from Huntsville. So that program through criminal justice and Beacon Recovery works with our folks who are uninsured, have limited resources. And my program works with hospital folks in an inpatient setting through consults and detox, and with patients who have insurance or the ability to private pay. So between the two programs, we feel we have a complete approach to helping local folks with addiction issues. And hey, Julie Butler. All right. All right. So if you don't mind, Carrie, advance it to what are we going to talk about tonight? What is addiction? Addiction as a disease. How are we going to use that to inform the way we support those close to us? I know this is really geared towards families. So, you know, when I do lectures for patients, I typically say, here's what we're going to talk about, and here's why you should care. So what is addiction as a disease, and why do we care? How does that inform the way we interact with people around us? We do use a science-based approach. And then finally, we want to hear from people in long-term recovery for a personal viewpoint of addiction as a disease and recovery as a possibility. All right. Thank you. If you'll, okay. So quick presentation, but the science and the history of the past 60 years have demonstrated that addiction is a brain disease and one that most recover from. However, as a society in the United States, many of us from a policy perspective and from a day-to-day operational perspective treat it really as a moral issue. Although, you know, if I polled a group of people on the street, hey, do you think addiction is a disease? Most of them would say yes. However, if we look at how people, professionals, interact with patients in the hospital, if we look at how families interact with someone with a substance use disorder that's close to them, we still treat it, as Carrie said, as the title of this program. Why don't you just stop? Don't you see what it's doing to your life? Don't you care enough about those around you? You know, what's wrong with you? So how did we as a society start to view addiction in this way? And you know, it could be a whole separate lecture, but a few points that I think inform the societal view are: number one, in the late 1800s, mental health did start to be addressed, but it was addressed as a separate issue from medical care. There were separate facilities for those that had mental health and substance use issues from medical care. And people started really looking at those as separate issues. We started with the criminalization of drugs and alcohol, criminalizing the use of and putting drugs into certain categories that made them illegal, you know, cocaine and opiates. I'm not saying this is a good thing. I'm just saying it it was a fact that those were used in the society without a prescription for some time. And so in 1914, the government came in and said, you can't do that anymore. And anybody who uses, has, or sells those products, we're going to attach legal consequences to that. We won't talk about the little prohibition walk that this country took, but we tried to stop the use of alcohol and addiction through cutting off the source of alcohol. And of course, that did not work, and we know the outcome of that. But those who drank and those who sold alcohol, there was a lot of stigma attached to that, and associated with being a criminal in an underworld society. And then we have the war on drugs, where there was a lot of national propaganda. Public enemy number one. So if we look at drug abuse as a war, who are we fighting? How do we win? Who's the bad guy here? So this view of addiction as a moral issue, and those who used as bad people, criminals, let's put them in jail, let's teach them a lesson, has been with us for a while. And although, the Board of Medical Examiners has considered an alcohol use disorder as a disease since the 50s, I think it's taken us as a culture a while to catch up. The good thing is we are seeing with the opiate crisis a lot of hearts and minds change, and a lot of focus on, instead of punishing people and making them do right, which hasn't worked, people have started looking at what's the science behind this? Why can't somebody just stop? And what can we do to support their efforts when they are trying to change? All right. So what do the experts say? One of the oldest professional medical societies is the American Society of Addiction Medicine, known as ASAM. And they were founded in 1954. And this is a group of physicians who examine and research addiction as a disease. And one of the things they do is come up with a definition of addiction that they hope will help people understand it and start to drive policy. So this is the American Society of Addiction Medicine, or ASAM's, current definition of addiction. And I want you to just focus on a few words that they are telling us are important. This is their short definition. If you want to, we can send out the link. They have a public website, and they have this definition, the short definition, as well as a long definition, which gives a much more complete scientific view of addiction as a disease. But look at these keywords: treatable, chronic, medical disease. It involves brain circuitry, genetics, the environment. People who have an addictive disorder become compulsive. That means they do stuff even though it's hurting them, right? Compulsive and continue, sometimes despite harmful consequences. And then their second bullet point, which is something they've added, I think in the past 3 years, maybe 4. Prevention and treatment are about just as successful as those for other chronic diseases, diabetes, heart disease. So when we approach addiction, we want to think about it just as we do as other diseases that many of us live with day to day and struggle with, right? Have we ever known somebody who has diabetes and has difficulty maintaining a healthy diet, even though they know veering from that diet could hurt them? Have we ever met somebody who's had a heart attack and they know that daily exercise is going to be part of what sustains their life, and they fall into some old habits? And I think the answer is yes, we do. So prevention and treatment work for addiction, just like any other chronic disease, which means it's going to be a process over time. There's going to be a lot of wins, and we're going to have to help people when they struggle. So I want to take a quick pause because I know there's been a lot of chat questions or comments. And Carrie, if you want to highlight any, I'm happy to address them.
Okay, so one of the questions was, what percentage is inherited, gene dominated, and what percentage of people? And I know, the stats that we use when we do presentations is they're still saying around half is genetically linked. I don't know if that's accurate. Do you have anything to add to that?
I do, and I just want to comment on our brilliant audience because we do have some of those statistics coming up. But yes, when we look at what contribution genetics plays in the disease, it is about 50%, 50 to 60% of what we see that's contributing to somebody having a substance use disorder is genetic. That means inherited, and that means things we can't control, right? We can't control the color of our eyes or different aspects of us that are inherited. So yes, good question.
Yes, and so there's another one that says, how do you navigate effectively through affordable programs when our insurance covers very little IOP and no inpatient? How do you find resources for financial help for your loved ones suffering from substance use disorder?
Well, that's a great question, and it's not a simple one. I think we'll be addressing some of those. Where do you go for help? What is help? What does that look like later on? And another part of the way we do it is presentations like this, is organizations like the Addiction Prevention Coalition that give some weight and importance to seeing this as a disease. And, some of this is y'all showing up tonight, these voices coming together and starting to be interested in this topic and doing the study and the research so that we can be good advocates. When I have a family come in and their family member comes to treatment and the insurance company denies them any benefits, I work with the family and I coach them and I say, you know what? They're not going to listen to me as a provider, the insurance company. What they listen to is if you, the consumer, calls them and says, this is a disease, this is a severe disease for my family. I'm concerned about the statistics and the risk of death. And I have, some information for you that this should be treated like any other medical condition. That's worked for me almost 100% of the time when I have families advocate to insurance companies for at least a little bit. So you're doing the right thing by being here tonight.
One more really great question.
Okay.
Can someone become addicted to prescription pills when they don't have an addictive personality?
Absolutely. Yeah. So part of what informs somebody's vulnerability to addiction is genetics, but there are a lot of other pieces that inform that vulnerability. A lot of times when someone has a prescription for pain medicine, it means their body is in pain, sometimes because they've had a traumatic event, a wreck, a surgery, pain in their body, which leaves them more vulnerable to addiction. One of the vulnerabilities to addiction is trying substances. So if you never have any drugs or alcohol of use, you will not have a substance use disorder. So even the introduction of substances is a vulnerability. And there have been countless patients that I've worked with whose first introduction to an opiate, which is a pain medicine, is when they had their wisdom teeth out. And absolutely, pain medications or opiates are wonderful medications to help us with pain. And they're also powerful substances that many people have a vulnerability to becoming addicted to. And doctors, sometimes they're starting to do more, but they don't do enough to tell people this should be short-term use for you. Your body can become used to taking this substance. We're only going to give it to you for, X amount of days. So great questions.
So I know you've got to move on with your presentation because we won't get any further, but I'm telling you, these questions are amazing. And
Yeah, it's
it
fun.
makes me want to have a whole session where we just answer questions,
Yeah.
because every one of these is valid. And I'm just going to say this, and then we're going to have to let you go on. But
Sure.
the risk factors. I can actually, so you can hear me, see me when I'm talking. People are asking about environmental variables. So as we're talking about prevention, we talk about the risk factors, and then we talk about preventative factors, that you apply. But it is certainly genetics, and it is certainly environmental, and it is certainly individual. So those are kind of the triangle that we talk about. So environmental absolutely plays a big role in it as well. So, okay, we're going to let you go on.
Yeah, sure. Yeah, to me, I would love to do a Q&A session, because
I think we
that's
need
what's
to,
really
because
great.
every one of these questions has so much we could talk about with it, and they're so good. So thank you so much.
Yeah. So addiction is a brain disease. So drugs of use, all of them, alcohol, marijuana, pain pills, anxiety pills, nicotine, all impact the communication centers in our brain, right? So our brain has communication cells in it, neurons, and they send little signals back and forth to each other. And they send those signals through chemicals called neurotransmitters, right? That's the way our brain works. Well, addiction, chemicals of use come into our brain, and they look like these communication chemicals, right? So they come in, and they are sort of like a Trojan horse. They tell our brain to do certain things. They can stop, if you see this, little communication cell, they can mimic communication chemicals, neurotransmitters. They can block cells from taking up these communication signals. So all of them work in our brain and affect these communication chemicals. All right, if you'll forward it just one. So when we do things that feel good, at least for me, one of them I enjoy is eating. Our brain feels good, and our brain releases a chemical that says, this is good, pay attention to this. Food is going to help you. So when you eat food, it feels good. You like it, for most of us. And our brain, through these communication chemicals, says, that was good. Pay attention to that. Look for more of that in your environment. If you can kind of imagine our early ancestors trying, let's say, a strawberry for the first time, when you're used to, I don't know, whatever food they had, your brain enjoys that. And it also creates a memory and says, that was good. I want you to pay attention to that. Start to look for other things that look like that strawberry in your environment. Well, drugs of use cause that same pleasure in our brain. Only if you can kind of look at that, if, let's say, food, on a scale of 1 to 10 is about a 2 on the pleasure meter, well, drugs of use are about a 10. So they come into our brain and they feel really good. And they also trigger our brain's natural ability to pay attention to what feels good. This is important for you. Do this again. Look for more opportunities like that. Right? So I think, well, we'll talk about this later. I was going to say, so if it feels so good and if we learn to pay attention to it, the question for tonight is, well, why some people and not another? Why this person who can have a drink and say that feels good, but that's it, and that's where we come into some of the risk factors, as Carrie said. But just want you to know, drugs of use do impact our brain. They impact the way our brain works normally, which is to pay attention to what feels good, remember it, and look for more of it and find ways to get it, because we're smart people and we're creative people. And folks with substance use disorders are just the same. Their brains are just paying attention to something that's not really good for them. That's why I was saying it's that Trojan horse. Okay, if you don't mind advancing. So why are we talking about this? Addiction is a very common disorder. Typically, over the course of their lives, we look about 30% have met criteria for an alcohol use disorder, 9.9 another drug use disorder. But at any point in time, there's about 8 to 10% of the US population, and this is a long-term statistic, that has an active substance use disorder. So, if you're giving a lecture or if you're teaching a class to about 100 people, you can think there might be 10 of those that may have some issues around substances at that time. If you just kind of take a random sample. And I've had that happen. I've taught classes, and at the end, on substance use disorders, and at the end, I've had a student or two come to me and say, can I talk to you privately about this? So it's a common occurrence, and it's one we should talk about more, All right. Thank you. So how does it happen? Somebody asked, and as I said, y'all are already thinking ahead, which is great. How does this happen? Why can some people get pain meds for their wisdom teeth and that's it? Maybe they even liked it, but they're not going to remember that as super important, search it out, try to do whatever they can to get it. So we know, and I know this sounds really simplistic, but we do know that genetics account for a huge part of the risk of addiction. And it not only, they've discovered, I think, over 23 genes that not only contribute to someone developing a substance use disorder, but how likely they are to try alcohol or drugs, how advanced their addiction may be. We certainly know we have people who seek treatment at all different levels of their disease, from sadly some people we know who've lost their lives to addiction, to some people who have a few consequences and say, okay, I'll change and I'll be open to doing something different. Not that we don't have many women who have a substance use disorder. There just is a slight more occurrence in men. We have mental health issues that contribute to somebody's vulnerability. So, one of the links that I think is they've kind of, research has shown there's an almost one-to-one link of folks who have bipolar disorder. If they drink alcohol, there's a large percentage, I think it's like 70%, who develop a alcohol use disorder. So there's a real genetic link and a vulnerability with those two, the mental health use and the use of alcohol. Have they found out all of the reasons why? No, but they know that this thing exists. The earlier someone tries drugs or alcohol, the more vulnerable they are. And trauma and stress. And those I put on one line because trauma is stressful, so it's kind of hard to tease those out. I had a great person who used to do a lecture on vulnerabilities, and he talked about which brains, right? Because it's a brain disease, which brains are more at risk. Well, part of the risk is genetic. Does your brain enjoy the chemicals? Which there's nothing we can control about that, right? It's just how much do your little neuro chemicals in your brain get going if they have a substance. There's nothing we can control about that. That's the genes. How likely is your brain to remember the experience of drug and alcohol use? And how likely are you to look for other opportunities to use? So that's all the genetics piece. But trauma and stress, you know, they really leave us vulnerable to lots of issues, but addiction is certainly one of them.
Ron, when somebody's asking about the percentage that actually recover, and I've wondered that myself. Do we have any statistics around how many people find sobriety?
Yeah, that's a great question. It's a hard one to measure because many people that we have the privilege of working with don't really follow up with us when we try to do some longitudinal studies. The American Society of Addiction Medicine, ASAM, says most people recover. The sad thing is most people don't get professional services. It's about 25% of people that get professional services. So if we look at those that get professional services and who are required to follow up with what's recommended after treatment, and who do you think those people are? Who do you think that group is that we study that has the resources to get treatment and then has to follow up afterwards with what is recommended after treatment? I'll let Carrie guess since she can be our talker.
Those that are in trouble?
Somebody, I think it was Kelly, says professionals. That's right. And Brianna says criminals. So yeah, the studies have been with those in our criminal justice system and health, especially healthcare professionals who, of course, those with a criminal justice background sometimes don't have the resources to go to treatment, but sometimes are required to do follow-up that's helpful. And so when we look at recovery rates for just the average person in treatment, for the first attempt, it's about 25% of those who are sober a year. When we look at healthcare professionals or those in other structured programs who go to treatment, but then have a system of accountability, for the next 3 to 5 years, the recovery rate is between 85 to 95%. Let me say that again, 85 to 95%. So what are the takeaways here? Number one, we need more people to have access to treatment. When they get treatment, they do better. And number two, we need systems in place that help with accountability after treatment. Treatment's good. I'm in the treatment business. I love what I do. It's step one, right? It's if we're lucky, 90 days out of somebody's life, out of a 365-day year. It's not a lot. And I tell my patients that. They all, I'm good, I'm ready to go. I was like, until you have a system out there of support and accountability, you need to be with us. Once you have that out there, you don't need us anymore. So great question about, and I think I'll speak on this. And if you can just click one more time, Carrie. So when we look at sometimes, I think this next piece is going to be looking at, and if you'll click one more time, Carrie, just how the brain works, right? So the earlier someone tries drugs or alcohol, and if their brain is genetically vulnerable and it starts to learn and it starts to pay attention and somebody uses more, their brain changes, it adapts. And so I don't know if any of y'all have ever sort of looked at studies of children who learn another language, when they're like 2 or 3, and how their brain really, the pathways are so sort of flexible the earlier we start something, right? And we build a brain. And the same thing can happen with addiction. The more we do something and put work into it, even if it's using drugs or alcohol, the more we create a system, just like we prune a tree. This is, I'm going to give credit to Dr. Leah Leish. We can create a shape that wasn't there before if we slowly start to do something again and again. And so when we look at somebody who has a substance use disorder, they've really created a certain shape in their brain. And we want to acknowledge that that is powerful for them. And that's why we see relapse. I think I saw in the chat, somebody said, of those that go to treatment, only 25% are sober at a year. Well, it's not an insignificant thing that's happened to their brain. Their brain is a good brain, and it does what it's supposed to do. It pays attention, it focuses, it works on one thing, it learns. And if that thing is drugs, alcohol, they help me, they relax me, I need to do it more, I've got to find it, then that pathway is shaped, and rechanneling it really takes some work. It can happen, and we're gonna get to that. But yeah. And somebody said neuroplasticity, you're right. And the good thing is there used to be sort of this myth that after a certain age, our brains really couldn't learn new things. And, once you're this way, you just are this way, that's your personality. And there's been some great work in the past 50 years with those who are recovering from strokes and have lost, literally, had damage to certain parts of their brain. And with treatment and with physical therapy and speech therapy, their brains actually form new pathways around the damage that allow them to have regained function. And and that applies to addiction as well. Yes, the brain can grow and change at any age, but it is impacted by addiction. So drugs of use cause our brains to release a lot of this pleasure neurochemical. This feels really good, right? But it's like money in the bank. Once you've spent it, it's gone. And you feel kind of bad after. I don't know about y'all, but you get paid on Friday. If that money's gone Saturday morning, Saturday and Sunday are kind of a bummer, right? Well, same thing with drug use. Your brain has a lot of this feel good after using, and then there's no more pleasure neurochemical. It's been all used up by drugs that cause a big release of this pleasure chemical. And so people feel bad. And when you feel bad or down, and you've learned to pay attention to what feels good, go after it. Let's just say the money example. You spend all your money on Friday. Now it's Saturday, you're kind of bummed out, and all your friends are going out Saturday night. What might you do if you really want to have a good time Saturday night and you're out of money? I'm sure
Visit
none
the
of us.
pawn shop or
Yeah, you might borrow some money or sell something. Exactly right. You're going to try to find a way to get more. And what those with substance use do is use more, right? So you use a little, feels good, then I kind of feel bad. Well, let me use more. But you're actually depleting that pleasure neurochemical more and more. And it's impacting, the actual production in the brain. So people who have a severe substance use disorder may find that they're not enjoying drug or alcohol use anymore, but they're just using to not feel bad, just to get to, even feel bad, but not that bad. All right, let's pause for a question or comment.
And it's 7:15, Bronwyn.
All
So
right,
just a
that's
time
good.
check.
Oh, okay. I'm supposed to wrap it up. Okay. All right, if you'll advance one more, let me just look. And one more, we'll skip that one. I just want to show you the cycle of addiction. There's the use piece, that's acute reinforcing stage. That's when you stop, feels bad. And what we find is a lot of people go into treatment during the feel bad stage. And then they think, that's enough. That's good. I'm okay now. I've worked on this physical part. But what we want to educate about is the brain is not just that feel good part, right? It's also, remember that pruning, that bush that we've gotten to look this certain way, right? So if we suddenly stop pruning it, it's going to take a while before it returns to its natural shape. And that's the same with the brain. So detox is good. It's necessary, but we want to work with people long-term because recovery for the brain takes more than 3, 5, 10, 15 days. And that's why aftercare and support is so vitally important. We really are helping people to form new habits. All right, if you'll advance it. These are just some things that our friends go through when they stop using. And there's a reason why a lot of people relapse 1, 2, 3, 4, 5 times. It doesn't feel good at first to stop using. And again, that's the reason for support. All right, if you will advance it. The good news is, and we're going to get into the personal aspect of it, what happens when somebody stops using over time, gets support, and develops new healthy habits? Guess what? That brain can change as well in a positive way. And so when we look at somebody, just look at this. This is somebody with no substance use. Our first image. And this red part is the ability to produce that feel-good chemical, right? After 1 month, they're really not able to feel good naturally yet. But at 14 months, it's returned to normal. So there's the hope in that. And we're going to talk about that from a personal aspect as well. All right. So what is recovery? It's breaking those habits, that chain, and developing a new pathway. And we're just going to skip this next little slide and take a few questions. Somebody's asking about the role that ADHD plays in addiction. There is a role. It's a complicated one. Untreated ADHD leaves people more vulnerable to substance use disorders. However, treating ADHD, if somebody doesn't have the right diagnosis, a developing brain can be given a drug of use, a stimulant, and leave somebody vulnerable. So with ADHD, it's important that people get the right diagnosis and that we never, ever count on drugs alone to fix a problem. It has to be behavioral measures as well.
Somebody's asking about, is dopamine detox a real thing? I see online that it can reset the brain. It might help with addiction cravings. I'm not familiar with it.
I'm not familiar with it. Certainly, we know that medication-assisted treatment can play a big role in recovery. Again, I just caution that that can't be the only role. Substance use disorder, yes, it's about chemicals in the brain, but it also becomes, as I said, about habit, about thinking about what's important, about relationships. So, the chemical alone is never going to solve the issue.
And you want to say just a few words about MAT?
Yes, MAT, medication assisted treatment. Now we call it MOUD or MAAD. So medication that helps someone in an early state of recovery. And there is a lot to say there. There's medications that help somebody with cravings that are not something that people can become reliant on, like naltrexone or a camprosate. And there's also sort of replacement medications that do have a potential for overuse, like methadone or buprenorphine, but they're great in our range of helping people to prevent harm and be able to have structured activities day to day so that they can recover more fully. So yeah, I'm a big proponent of MAT for those that need it. And in our program, we really work with our doctor and the patient individually, looking at their history, their needs, and their situation to decide what medication, when, and how. And a lot of people don't use it, and some do. So it's a great question.
Okay, there was a couple of questions about underlying root causes, that drive addictive or behaviors, self-medicating, and the importance of dealing with those, once the substance has been removed and there's some sobriety. And that's really part of what you're talking about, the long-term, working with sponsors, sober living, learning how to live life on life's terms, so.
That's right. And for those who have a history of trauma, abuse, and stress that may have increased their use, started their use, working on those root issues and getting support for that and treatment of that is going to make all the difference.
So many good questions. We cannot answer them.
I know they really are.
I'm going to copy
the good stuff.
Yes, we got to get to the good stuff. So I'm going to promise everybody that I'm going to copy the chat at the very end, and we're going to take all of these and we're going to schedule another session where we talk about these topics that we're not able to talk about tonight.
Great. So yeah, if you'll flip the slides, as I said, when I'm not a person in long-term recovery, but I'm an ally and an advocate. And I am very humbled to get to work with people in recovery. So the folks that'll be talking with you tonight are folks in long-term recovery. They're also professionals in the field. So they really have a unique and wonderful viewpoint that's very meaningful in the work that we do. And so Al, Sheila, and Vicki are going to take just a minute each to introduce themselves. I'm going to get up and just get a water to drink while I am here. So if you don't see my face, it's just to get a water. I'm going to let Al, Sheila, and Vicki just do a minute each to tell you who they are and why they're here tonight, because I think their words matter, much more than mine. So if we can go in that order, Al, if you want to chime in first.
Hi, everybody. My name is Al Cotton. I'm a person in long-term recovery. And what that means to me is I haven't felt the need to use alcohol to adjust the way I feel, to deal with my anxiety, or any of the things that I used it for since September 13th, 2001. I ended up getting sober at a time when the entire world seems to be going crazy. So that's what I wanted to say. 9/11 had happened 2 days before, and the DUI that brought me into AA finally happened about 10 days before that. And so I came in through the legal route, and it turned out that back then in 2001, what my assessment said was 3 meetings a week at AA, and I went and immediately found a great benefit there. After my second DUI, I actually went to a meditation center. And so I think one of the reasons I got sober is because I meditated for such a long time, and it really brought some stability to my mind and gave me a space to be able to do something different when circumstances forced me to consider it. But I fell in love with AA. I ended up going to 2 meetings a day frequently in the first year or two, and I'm just immensely grateful that there were people there who could point me toward recovery, because nobody gets sober alone. I would not have done this without 1,000 people around me in Atlanta. So really glad to be here and amazed at the way that recovery has changed my life.
That's beautiful, Al. Thank you. Sheila?
Hey everybody, my name is Sheila and I'm a person that's in long-term recovery. I've been in recovery since 3303. I didn't get here by accident. I went in and out of treatment at least 8 times before I actually decided to stick and stay. And what caused me to stick and stay is that I became open-minded and willing to take the suggestions that was given to me. I came in and out of treatment a number of times for other reasons besides myself, but when I came in for myself, that's when it really worked for me. I also work here as a profession and do just to add on to some of the things that Bronwyn was talking about, we do detox here. And when I talk to a person that's going through detox, I also let them know that, hey, you're getting detox, your body physically is being detoxed, but now let's detox the mind, which means going into treatment. That was very helpful for me because when I heard that I was the majority of my problem and only 1% was the drugs and the alcohol, I bought into that. That meant that recovery has allowed me to work on me and to love me. And when I started loving me, I stopped hurting me.
Thank you, Sheila. And I really love the way you say, and you're so kind to our patients, all of you are, but I love that you said you've detoxed your body, now let's do the mind. That means treatment. Lovely. I'm gonna steal that, Sheila, but I'll credit you, don't worry.
Okay.
Vicki, do you mind going next?
I don't mind. Okay, my name is Vicki and I am a person in long-term recovery as well. And I have been in recovery since 4/2/1992. And I came in for multiple reasons, but the most important reason was to relearn me. And again, as Sheila just said, when I started to change my thinking, I was told early on, if I change my mind, I'll change my life. And I believe that knowledge is power. And I was just glad to know that there was something else besides, what I thought was the criminal justice system and all the other ways that I had previously came in. But I believe that self-care is the best care. And when I started to take care of myself and stop doing it for everybody else and do it for me, that's when I began to really recover. And as Bronwyn said earlier, I'm here personally and professionally. My first job entailed on me telling people my story. The first job I had when I got clean was and it was through UAB, was to let people know what had happened in my life. So my experience, I believe, is my strength. Thanks.
That's beautiful. Thank you, Vicki. And I will just say that Vicki not only says that she does self-care, but she lives it. And she's really, since she's come to work from us, helped us all focus on that. So thank you all. All right, next question. And I'll pause after this next question to see if folks have their own questions. But for each of you, and you can all answer, just one of you if you want, y'all decide. I think a lot of parents, a lot of families want to know, like Sheila shared or Al shared, it wasn't time one that I sought help, that something clicked for me. Do any of you have any insight into what was it for you, or do you see in general with patients that you work for that makes that difference to where somebody says, I'll be willing this time, or I'll open my ears this time, instead of telling you to get out the room, I'll tell you, okay, come in the room. Do any of you have any, in any order, any insight into what helps somebody just make that change?
I'll go if nobody else.
Okay, yeah, go ahead, Vicky.
I think it's for me, I think going into a room, I'm new here and I'm learning this all over again, and it's been a while, but I'm going into rooms and professionally, as what I have been doing for almost 30 years. But I think it's the identification for I'm not alone, and somebody that can share the experience. This happened to me. This is where I was at one point. And I think the partnership, just partnering with family, with the peer, and letting them know that they're not alone and we don't recover alone, and just that added support.
And that's great. And I think both you and Al have said that, you know, you don't recover alone. What is some of the difference? It may be somebody telling you, I went through that too. You know, you're not weird, you're not strange, you're normal, and there is a solution. Thank you. Sheila or Al, any comments on that? Just anything you notice for you or other patients that helps just break through, because we know it's a powerful disease.
To actually be able to look at a person and to give them some hope, to let them know that, hey, I was a person that stayed sick for almost 25 years, and I made a change after 25 years. To give them hope, to let them know that, hey, my past is my past, and now I'm responsible for my future.
Great, thank you.
So for me, I would not have gotten sober if I hadn't had some serious consequences that forced me to do something I did not want to do. I don't know how AA manages. For me, that's what I used. And I don't know how it gets us to do things we don't want to do, because that is the mystery. You know, nobody, I mean, I did not come in wanting to stop drinking. I wanted to come in to look good to the judge. But I remember, so this was during 9/11, and it was a very anxious time in the world. And what I found is after I was going to meetings, the only time in the day that I wasn't anxious was when I was in the meeting, and for about a half an hour afterwards. And so I held on to that half an hour afterwards. And I remember the time when I heard people talking about the crazy way they behaved in addiction, and everybody in the room erupted in laughter. And it was that kind of thing that made me know that I could actually look at what I had done and not have to be ashamed of it. Shame is such a deadly thing in recovery, and anything we can do to let people know that this is a disease and that that shame doesn't help, and that you're a good person, and if you want to do this, come on. But it's hard to figure out how to, get people to do it when they don't say they want to do it.
Well, I think that's really helpful, Al, that, and in treatment centers, we used to say, oh, if you're just here for the court, go on. Now, I think we've really learned a lot about motivational interviewing. And I'm just like, whatever reason you're here for, come on in. Because as you said, Al, you come in for one reason and that changes. So I agree. Whatever brings somebody to the point of being willing to be in that room, let's take it. And I also, so I'll leave it with that. But great insights and very helpful. So Vicki, Al, Sheila, in hindsight, because I know at the time it's kind of like, you're not really paying attention to that. But in hindsight, is there anything that somebody could have done, said, something that could have been in place that would have been helpful? That now with the experience and looking back, you're like, that maybe you provide or that you see as provided now that you're like, oh, if that had been around, that would have been good.
For me, it's that, I had to figure out what was going on with me. I didn't come from a lot of I came from a two-parent household. I didn't have trauma in my childhood. The trauma I gained was through my
Mm.
youth. So during the time that I decided to get into recovery, I also sought out professional therapy help as well. The 12-step program helped me as well. Also, I did not realize until someone introduced me that there was help that was available to me, because at one time I did not know that there was help
Mm.
available.
So
So,
just be aware, there are resources out there.
mhm. And the resources, I had no idea about the resources that was available, because until someone had to introduce me to it. Someone had to introduce me to the 12 steps. Someone had to introduce me to the fact that, yes, you can go into recovery. Those are the things that I was very basically needed, to the fact of knowing that it was just available. The support of family, that was a crutch to me, simply because my family just didn't know how to help me. And the best way they helped me was to actually let me find my way for me. Uh,
And
I
both
found,
you and Well, I think both you and Al have touched on that. And I know it's hard for families to hear this, but sometimes natural consequences can start to have an impact on people. Sometimes we as families want to save them from it, and it's not that we as families need to punish or hurt our loved ones, but it's just like sometimes having the natural consequences come in and being there as a family and saying, I'm here with some resources to
yeah,
connect you if you need. Yeah.
What I would say also is that I've been very jealous of the resources that are available nowadays compared to what I had when I came in. I wish I had had counseling,
Mm,
and but what I often will suggest that to people who don't want to do anything when they get out, and point out that they've enjoyed talking to me. Wouldn't you like to have someone you could talk to? I mean, would this help you? But the important thing is to get the buy-in and ask them what kind of resources they think would help. Because if there's no buy-in from them, I don't know what will work. But but just and knowing that those resources can be available if it's something that they'll use.
that's a good point. And I got confuzzled earlier, and I wanted to just say, Al, thanks for mentioning the role of shame. Shame is a very deadly thing. It grows in silence, just like addiction. And, its message is don't talk, don't tell, same as addiction. So I think you're right. The more we can destigmatize this, as you, Sheila, and Vicky said, bring that message of hope to people and their resources, you're not alone, the better. So this is a tough question, and we don't ever want to blame or shame others, but Vicky, Al, and Sheila, I do want to know, what was not helpful to you? Was there anything somebody said, did, or a system in place? Doesn't have to be personal, that was just not helpful when you were in active addiction? Was there anything that made it worse, not better? Vicky, you want to go first?
Yeah, I think for me, just the stigma that was related to, just the name calling, the lack of support, my family not understanding. And had it been, years ago when I came in, it was like ancient history back then. Nobody had resources. And as Al just said, right now it's amazing. I am in amazement. I wish I had had a peer. Car accident, ending up in the hospital under the influence. If somebody had have come to my bedside, it would have made a world of difference. So just the stigma, just being talked down to all the time, and being, when everybody come in the house, here come everybody getting their stuff and gathering up their purses, and that, all of the things that that said, this is a drug addict, which is what was, you know, that word, those words, our words hurt.
Yeah.
So yeah, that, thanks.
Yeah, words have power. And, you know, even in the past 5 years, I've changed mine. You know, the way we speak and talk is such a way to advocate for our patients, you know, and I still see in charts, this is a long-term drug addict, you know, instead of using clinical language. And so, yeah, well said, Vicki. Sheila or Al, we're going to get to the good stuff, but we got to go there. We got to know what was not helpful, what hurt. Al or Sheila?
For me, it was just like Vicki said, you know, the shame and the guilt of, and the words, you know, it was very painful, you know, for someone to call me a crackhead or an old drunkard. And you know, like, you'll never get better. All the stigma that came along with it was actually kept me from sometimes, because I bought into that stuff. Well, this is who I am. That's who you think I am. I'll be that. Yeah. So
It hurt so much. It just
yeah.
was, yeah, kind of gave up.
Yep.
Yeah. Al,
And
anything?
I would say that the legal system was necessary for me. It got me through the door, and it kept me in there for 16 months. So I didn't have the ability to decide whether to go to AA on my own until I had well more than a year sober. And I'll tell you, even when DeKalb County, Georgia stopped looking at me, was a tricky time, you know, because once you're under some kind of observation, once you're not under it anymore, then you get to make that decision about what you're going to do. And do I want to keep doing this? That was the first time that I could do that. And I made sure that I went to a meeting the very next night.
Wow.
Because I didn't want to lose what I had gotten. But I think the legal system has gotten better too, in the way that it does provide support and does channel us toward the resources. So that's great.
Well, and that's a good, you know, thing that you've pointed out is the legal system provided, you know, as the research has shown, some accountability, some you got to do it for a minute, that helped your brain and your body recover, and you know, develop those support systems that sometimes it's just hard for somebody to do on their own at the beginning, you know, if they don't have to. And I am a motivational interviewing gal, but I'm also about support and accountability, and accountability works, and we just can't deny the research on that. Again, criminal justice systems or professional systems that don't put people in jail, but say you got to do the treatment. And so awesome.
So Bronwyn, a question in light of tonight's topic. Faye is wondering if everybody would share how hard it was for them to actually get sober. What was that process like, that experience?
Well, and that's a great question. And one of the ones coming up too is because we want to look at that and then also look at the good stuff, which is recovery. So yeah, what was it like to struggle? And then what did you notice as in recovery? Because it is a brain disease. So you probably noticed the struggle and then noticed the recovery as well. Great question. And anyone can go first. Maybe Vicki, you want to start?
I think for me, the recovery process is what it is. It's a process and not an event. And the struggle was extremely real. If you know the physical, the emotional, the mental, and the spiritual. And I think all of it connected at some point, but at different points in my recovery. Again, the physical was fine, the body was good, but this thinking, had to get this thinking right. And it's all, for me, it was all about changing everything. And just as hard as I went for my drugs, I had to also do that in this recovery process. So, and it was not easy. And as far as the relapses and all that stuff, I believe for me, relapse mean that I had to have something before. I didn't have nothing. I never stopped using. So I had to stop and stay stopped. And that was my whole thing. The stopping was easy if my mom said, I'm gonna do this, this, and this. And you know, those consequences, all the threatening behavior. So the stopping was okay. I would stop as long as they say, stop because of this, but the stay and stop, and that's when the recovery process started. You know, as Al said, going to meetings and doing those wraparound things, like getting some accountability in my life, getting some people that understood and that was there for me to help me. Those were the things, but yeah, that's it. Thanks.
I love that observation, Vicky, you know, and it really goes, as we said, so many of our patients or families think that it's just the physical part. And once somebody stops, okay, that's it. Now, you know, get back to normal. And as you said, well, that's the easy part, right? And we now have modern medicines. I mean, we can help somebody. No, it's the part after that, the thinking, the emotional part, the way you live, that takes the time. So thank you for that. Great insight.
So it's hard for me to assess how hard it was for me to get sober. I didn't even try after my first or second DUIs. So I don't think it would have been easy then. By the third time, and I had done a lot of meditating, I really came in, and what I realized is that I was such an isolator. And this was a place where I didn't have to isolate, where I could actually do the opposite of isolation. And so I fell in love with AA and did so much of it that every day I was doing something to remind myself that I was staying in recovery. And that was the most important thing for me to do. And finding people who would help me and connect with me. But I still had to undermine that natural tendency that I have to isolate, because that was my biggest problem. I am an isolator. I didn't want you in my business. I didn't want you around. Don't ask me how much I've been drinking. 2 or 3. None of your business. Those are the kinds of answers that you would get. And to be able to go to a meeting and share honestly and look at what was going on and just get that turnaround in perspective. That happened very slowly. I had to go, hundreds of meetings in the first year or two, but I think it saved my life, and I'm very grateful.
Well, that's really good insight too, for practitioners and for family members, that sometimes when we ask those questions to the person in the middle of the storm, it feels invasive, and we're thinking, oh, I'm helping. And they're like, hey, get out. Addiction is about intensity in the moment, but also isolation. And recovery is about intimacy. And that intimacy at first can feel like a sunburn. I mean, just not good. So thank you for that. Sheila?
Well, for me, recovery offered me the opportunity to get to know who I was. And because I really didn't know who I was. And it offered me the opportunity to really look at me and to forgive me in some areas and to move on. Recovery was a process that I had to understand the fact that I didn't get there overnight. And so I had to trust the process in order to get to where I am. So, and I got that through the 12 steps. For me, I went through 12-step program, and that opened the door for me to really look at me, which was the hardest thing about me, because I got angry with me. And at the same time, I started loving me also.
And I like that you said that, Sheila, because the truth is many of us, nobody likes to look at themselves, or a lot of people don't, right? And in a recovery, you're kind of forced to do that. And so sometimes when we get mad at our family members or individuals for not wanting to do that, it's like, well, that's a painful process. None of us want to do that, And so that's the gift of recovery, but I think also we can find some empathy that that's not an easy process. So thank you. Well, I want to end it with a question, because, you know, Vicki, Al, Sheila, each one of you has a personal recovery story, and you are professionals. So you are now in this position where you have lived it, but now you're on a day-to-day basis seeing people at every piece of the process in the hospital when they're just kind of figuring out this is going on, in detox, and in early recovery. You know, are there any insights that you've gained from the work you're doing that would be helpful for families to know? You know, just like one takeaway tonight, if you could tell them something that, you know, is that synthesis of personal and professional experience, piece of advice and a piece of hope to take with them tonight. Sheila, you go first because you're on the screen.
Well, one of the things is when I got better, everybody around me got better.
Oh, I love it.
Simple as that. And I did it for me. And because I did it for me, they reaped the benefits of that.
And it is, you know, we didn't get there tonight because we were talking about the disease and the biology, but there's the social aspect. It is a family disease. And just as people get sick, as folks are in addiction, I love that. People get better too. Thank you.
So I would say that we've talked a lot. First of all, we've talked a lot about AA tonight, and just want to make sure that people know that nowadays there are lots of other programs. There are 12-step programs for most every disease. There's a Buddhist flavored program. There's a faith-based program. There are science and psychology-based programs. So there are a lot of things out there that can help. But the thing that I would say to offer hope is that you should always try again. You never know when it's going to be successful. You never know when you're going to hit the mind at the right time, when the level of consequences are sufficient, where the level of willingness and is sufficient. But it's always worth another try. We don't say a second time. We say another time.
And I love that, Al. And I always tell patients and families, I'm not a mind reader. You know, I can tell you who I think will get recovery or not. And I've been right and I've been wrong. And I'm like, you know, if I was a mind reader, I'd get paid a lot more. And I'm not. So that means every time I got to go in and give it a try. And same with families. So thank you for that. That's really true. Vicki, you want to leave us with a final word on your insight from personal and professional?
I would just say that I'm just responsible for planting the seed and being the attraction, and not the attraction of as how I look, as to how I'm living. I would just rather be a story than tell a story. So I just want to continue to encourage and support and give that hope shot. The hope shot, as Al just said, of another chance. You never know when it may click. I may say something to somebody today, they may not get it until whenever, but I'm responsible for saying it, and I'm responsible for being the example and being the attraction that has happened for me for almost 30 years. Just watching the process and being in position to be of service, and just knowing that service is not a position for me, it's a posture of my heart. So this is hard work for me. Thanks.
Thank you, Vicki. And I think that's a great way to end it, because, and I love that visual, planting a seed. We are responsible for planting that. And I want families to know that too. What we say and what we do may not bear fruit the next day or two, you know, I mean, this is a different metaphor, but with my kids, I may not see the way that I've parented them bearing fruit till they're like 30, you know, but that doesn't mean that I shouldn't every day try and be kind and come back to it. And I don't think of patients as children at all. I just think it's a good metaphor that we're planting a seed. And sometimes the work we do as family members and as professionals, we're just not going to, we don't know when we're going to see that fruit come. So thank you. That's a beautiful way to close out. And, my takeaway from tonight is thank you so much to the people who showed up. I'm convinced we need to do this more often because there's so much interest and enthusiasm. I want to I'm going to turn it over to Carrie, but I do just want to tell y'all that as a treatment center, we treat and we work through the hospital, and we have a lovely IOP if anybody wants to reach out to us, but we believe in giving back to the community as well. We have a free family support group that meets every Thursday right now via Zoom from 5 to 6:30. And Mike Martin is our contact. We'll put this in an email to all y'all with resources, but he's at 205-975-8402. And again, that's a therapist-led meeting for the community, free for any family member who needs some help, support, and some education. So Carrie, thank you for tonight. And I'm going to turn it back over to you.
Right. And we did it. 2 minutes to spare. Thank y'all so much. I am so thrilled that, we've been talking about this. Bronwyn and I have been talking about this for a while, and we've been working on it. And just to be here and to have people here, to have our wonderful guests here sharing their story, it's so encouraging and so inspirational. So this is where I've put a survey in the chat. If you guys would just it's really short, really appreciate it if you would just take a second and fill that out for us. I put a link to the next event in the series, and what that is going to be, it's on a Saturday morning, and it's going to be an introduction to craft, which is a community reinforcement and family training. And that is really for concerned significant others that are walking with somebody that they love, that are struggling with substances, and tools and a way of relating, and it's evidence-based. And so that is going to be an introduction to craft. It's free, it's virtual. I would love for anybody to participate. What we will do is we will send out, Bronwyn, are you comfortable sending out your slide deck or not?
Yeah.
Okay.
And I do just want to plug this craft training. I just did this little science thing, but you're going to actually get, as family members, like a to-do list. Do this, do not do that in craft training. And my colleague of over 20 years, Mike Martin, is going to be part of that training. He's amazing. And there might be another amazing trainer in there too, but I really want y'all to go to that. This is the how-to, right? You got the introduction tonight, go to that.
And so you will get an email from us, from everybody that signed up for this event tonight. We'll send you the deck from Bronwyn. We'll send you the link to all of the rest of the series so you can look at that. And we'll send you contact information. Anything else that we need? And again, I'm going to hit save right before I shut this down. So I've got this whole chat, because we definitely have so much more that we want to talk about. But thank you again for your time. I know your time is valuable, and we are thrilled to be here with you. So reach out to us, let us know what you need, because we're going to continue this. So we hope all of you have a fantastic evening, and we'll see you again soon.